Welcome to the Resilient Performance Podcast. This is Keep It Real number 20. We got a question about from a good friend of ours, John O'Neill, up in Massachusetts, about things that we look for when hiring somebody. So we just recently announced yesterday, which who knows when this podcast is actually going to go out, but early February we hired our second employee, Joseph Ho. And we have he's going to be at our New Jersey location. And then we have our first hire, Anuja Gate, at our New York location, she's been kicking ass over there and doing great stuff. Definitely want to get her on here at some point in the near future, for sure. Talk about her experience as a trainer for a decade almost before being a physical therapist. That's a very valuable thing. And I'll start with that as something we look for with our new hires would be some sort of coaching experience. That'll be my first bullet to kind of kick this off. And that's also something we look for with our students too. Whenever we accept physical therapy students, our thought process with it is we want to give them a good experience, kind of give them things that they want to kind of fill the holes in what they think might be, their sort of weak points as a clinician, because everybody's a little bit different. Everybody comes in a little bit different. Like we've had one student who came in and he was a licensed massage therapist already. So it's like, all right, we don't really need to go over manual stuff too much with you. We're going to focus more on, training type things or whatever. And so, yeah, I'll start off with that as the first bullet we go with is on a resume. We're looking for some sort of training, coaching experience, either as a personal trainer, strength and conditioning coach, just something that gives you the skills to work with people in some one-on-one capacity or small group capacity where you can kind of juggle the time that you have with people, and you can have a smooth sort of session where it's not just like choppy and you're not really sure where you want to go next, as opposed to if you're a trainer, you have experience, you're a strength coach, you have experience there. In your head, each training session sort of has like a flow to it, and you're going to start out with this and end with that. And in the middle, we're doing some of this stuff. So that's definitely a huge skill for us and a big resume booster for us when we look at students and when we consider someone for new hire. Who wants to take it? Go for it, Trevor. Or Doug, go ahead, Doug.
No, I think that's a good place to start. And I mean, even if someone doesn't have like a strength and conditioning background per se, I think just having some background in teaching people how to do things, it could be even a sport. Like I coached skiing or soccer or dance, just where like you had to like actually take something theoretical and get someone to apply it and do it, I think is really important. And then, I mean, we're lucky because we're small enough that every single one of us can have oversight over whoever we hire. Whereas if you're like a really big company, then you've got to have a process that's a lot more impersonal. But I mean, like for us, really, the people that we hired, our first and most recent two hires, we had an interview, but it was really more of a formality. Like we almost knew before the interview that they were going to be the people that we hired, because in Joe's case, he had done a clinical with you. So you're not only seeing that he's like technically competent and that he, has the right educational background and credentials, but you're seeing how he is socially. And even if he's not doing a lot of treatment, individually in the clinical, you're seeing how he interacts with patients and athletes. And if he's the kind of person they want to be around, that's probably like we can teach people to do anything for the most part, but
that was something I wanted to mention too. I forgot about that. Is like when we take students, we almost want, like, that's sort of like our interview process as well. And if you do well as a student, it's in our best interest to make you as competent as you possibly could be, as if we would want to hire you. Like you could replace us. That's sort of like a goal that we would have for our students. And it's not always appropriate, it just depends on the student, but that's sort of like in the back of our minds as we go into it, that it's somewhat of like a job interview for sure.
Yeah, and so there's that piece. But I mean, like even with Anuja, like I knew Anuja because I was a member at the gym that she trained at. So, I mean, she was actually a friend that we stayed in touch with over the year. We stayed in touch over the years. And then when I found out that she went to PT school, like immediately I knew in the back of my mind, and she was like a top tier trainer, or is still actually at Equinox. So you know that she's been vetted. And if you're the kind of person where for 5+ years, like people want to see you 3 days a week, that says something about you. And so when she went to PT school, in the back of my mind, like even without having to do any kind of formal vetting process, I'm like, wow, this would be like a great hire if it was the right fit for her. So when she graduated PT school, and then we were looking for somebody, it was almost like, yes, we all like talked to her more so because you didn't know her, and we wanted to, I wanted you guys to meet her, but it was as much, the interview was as much for her as it was for us. Like we kind of, or at least I kind of already knew that like she would be a great fit. And then it was more like, hey, is this going to be a good fit for you? And because, frankly, she was doing really well as a trainer, was it going to make financial sense for her? But she obviously wanted to get PT experience. So it was mutually beneficial. But, if you're small enough in an ideal world, like you don't even need to interview. You already know who you're going to hire. And then it's just a matter of having a conversation saying like, hey, what's it going to take to make this worth both of our whiles? And it's like a much easier conversation than like, I feel like if you have to rely on an interview with someone that you don't know, that just leaves so much to chance. The interview should be a formality. And luckily we're small enough that for us, the interviews were a formality. But we kind of already knew who we wanted to hire before that formal process. So I guess as much as you can like decentralize it and make it informal and have real relationships. Like you guys had a real relationship with Joe,
Exactly.
a relationship with Anuja. So it made that transition to having a professional relationship very seamless.
So I think both, when I think about Anuja and Joe, I think about like the intangibles that they have, which is just their character. And that's something that we look for, is we want people who we want to ourselves enjoy being around. And that's what I think of from like a business, not even a business owner standpoint, but for somebody working in the clinic on a day-to-day basis. It's like, I want to show up to work with who I want to work with, who I want to be around, who I want to interact with, who I want to help create like an environment that patients want to be in. And I think that's why, like, when I think about the three of us, things have always worked so well because we were, PT school classmates, and we had a great friendship before we kind of came into the business. And when we are in the clinic together, like there's a social interaction that brings just a good feel to to kind of like what we're doing and who we're with, and patients definitely feed off that. I think feed off of like being in a good atmosphere and being in a good environment, which like just starts with like the type of person that you are. It's like when Greg and I are in the same room together working with our clients, like it's fun. It was the same thing when Nuja's working with her clients in the city, like, and we're all around. It's fun. When Joe was here as our student, like he helped just add to the.
So yeah, so having some technical issues with Trevor, but just to summarize kind of what he was talking about, we're looking for people that we want to be around on a daily basis, because that's important in the workplace environment. You don't want to hire somebody that you then are forced to be with on a day-to-day basis, who you don't even really enjoy spending with them that regularly, right? This is something that you're doing, around 5 days a week maybe. So you're at work just as much of the day on a weekday than you are at home. So you kind of want it to be like an extension of your friends and family group. So that's something important to us for sure. And then another bullet that I would think of is just like a desire to develop, which is something that I feel like I think most people have it. I think it's just a matter of being exposed to the right things and being in an environment that kind of fosters it, which is, again, something that we kind of strive for, is giving people the freedom to kind of look at different, look through different routes of continuing education. And, if you want to, we'll tell Anuja, if there's something that you're interested in and we can help you learn about it, we'll do as we can. But then if there's, some coach in Australia who's an expert on whatever it is, like, we'll do whatever we can to facilitate you learning from that person as well. Because then it's going to help us. First off, it's going to help that clinician become a better clinician themselves. They're going to be able to provide a better service, which is then good for our business. So that's a no-brainer. Then at the same time, we as individuals can then learn from that person. We can learn from them on the things that they learned from that imaginary coach in Australia. So that would be another bullet for me, is just a desire to develop, a desire to be exposed to some new information and absorb it and kind of synthesize it into what you're already doing. It's not a complete overhaul of what you're doing, which I'd say is like kind of a big deal too. Like if you go to a course and then all of a sudden you show up the next day and it's like, oh God, we were totally missing the boat. And, like everyone needs to be doing this one thing. Like Boo Schexnayder said on the podcast with you, Doug, like that's kind of a red light to him. And that's definitely something that we don't want to see either. You guys want to run off of that a little bit?
Yeah, I think like part of that, it's just like the self motivation and the self drive for like learning and just becoming better at your craft or whatever your profession is. I think that's what we've seen like with Joe, for example. It's like on the times when he's not here with us, it's like he's doing something to better himself, to kind of learn and asking questions and being thoughtful and being inquisitive about just kind of what it is that we do. And like same thing with Anuja, like just she asks great questions and is inquisitive about how to become better at, well, at helping people, which is essentially what we're trying to do as physical therapists. So I think that kind of self drive and like the altruistic behavior, I think that's kind of the word I'm looking for, about just wanting to find what you can to help other people. That's ultimately, like I said, what we do as physical therapists. Is we're trying to help the clients who come in and see us feel better, move better, do whatever it is better, whatever their goal is with us. And there's just being open-minded and looking for more learning opportunities is definitely something that we see. And I think part of that, like, both you guys were kind of saying before, it's like the prior experiences that you've done, whether it's personal training or being a sport coach or whatever it is, just like working with other people that's trying to benefit them to some degree is huge. It says a lot about like who you are, what you value, and is, again, like ultimately the different qualities that we're looking for in terms of like the person who comes in, who's comfortable, who can make people feel comfortable, who speaks well with others and like, is friendly, is kind, is warm, is welcome. Those just the qualities are so important, I think, to be good at what you do. Because ultimately, like you kind of alluded to before, Doug, it's like we can teach a lot of like physical therapy skills, but there's this level of the stuff Brett Bartholomew teaches, like the art of coaching side of things, that's really hard to develop and hard to coach. So having somebody who's kind of has some of that coming in is super, super helpful for us.
And I think also to kind of piggyback on that is people who take initiative, especially with their clinicals. Like, it's rare that we would have a student who is just content going wherever his or her program, place them. Because if you just rely on like, oh, I've got my outpatient ortho rotation now, you don't really care where you go, that kind of says something about you, because that to me is the most valuable part of PT school. So we've actually had students, reach out to us to ask us if we could take them for a clinical, and they proactively sent their resumes. And like, first of all, I would tell anybody like there's zero downside to you doing that, and it's all upside. I mean, I've actually been impressed with certain people where it's like, wow, like you had the confidence to, and they do it in a way where it's, it's humble and it's tasteful, but it's like, hey, here's what I've done. Like, would you, do you take students? And if you do, like, here's my experience. And, we've had people where like, if we know that someone's done a rotation at another really good facility, like say like a rehab to perform, like Josh Funk's facility, or like Champion PT in Massachusetts, or even like Exos, places like that. Like the fact that students have sought out those clinical experiences speaks to the fact that they want to learn certain things that are kind of like outside the traditional PT box. So, when they've had those experiences, like, oh, like we know that they've actually been trained really well by somebody else before they even come to us. So it makes our job a lot easier. And it speaks to the fact that they're not content just going to like whatever the closest local PT place is near their program just to check the clinical box. Because I don't think that like programs really that much different in terms of what they teach. You can only make anatomy so different, and in kinesiology and neuroscience. But the ones that I think are a little bit more progressive with their clinical education, that let students take more initiative. So that's a big thing. And then I think just, kind of related to that is, we are an out-of-network cash-based model. So the people who have that initiative and that confidence are probably going to do better, because we can't rely on getting 15 visits from an insurance company for something. Like if it's a post-op, then maybe we can, but we're under, and our students and our employees are under more pressure, where like people are generally paying out of deductible, paying out of pocket, whether it's like a high deductible plan or they're paying just pure cash and no insurance coverage. Like you don't have 5 visits, you might have 1 or 2. And then people are like, look, I'm not going to spend, it can be cost prohibitive. So you have to be confident that you can get somebody in a routine that they can do on their own and get a really good test retest and a positive change in 1 to 2 sessions. And I don't know if everyone, especially like new grads, are cut out for that environment. But obviously, if they've had a clinical with us, then we know whether or not like they're comfortable there, or if they've had other similar clinical experiences where they can work under certain time constraints, financial constraints, and they're autonomous. Because every place, including ours, likes to say like we're going to develop clinicians, and we do try to make time for that. The reality is like you're running a business, so the time it takes to like mentor somebody when they've already been hired, now that's two people who could have been treating that aren't treating because you're like setting specific time aside to mentor people. So we want people to like hit the ground running, and we're going to have like informal time that we set aside to like mentor and answer questions. But like, if we're being honest, we're not like setting a lot of time throughout the day to say like, okay, neither of us are going to treat, so we can develop you. Like a student, we might do that, but someone that we're hiring, like we can't. It's not wise as a business strategic move.
Yeah, and then along those lines too, we're looking for people who are just interested in and they've gone to different sorts of continuing education courses. We're not looking for this whole laundry list of a million different courses. Like just even going to a couple as a student, as a physical therapy student, that says a lot about you for sure. That you're, like you said, again, you're putting yourself out there and kind of looking for things that are a little bit, non-traditional. And we're not talking about going to like some sort of like way out of the box, like you're going to some course that's not even related to physical therapy at all, but we're looking just for like something different that maybe isn't taught in school. And yeah, like I said, it doesn't have to be a total laundry list of courses like we did. It's just like, it's not reasonable to expect that out of a student. It's also like pretty expensive too. So it's just kind of, it's unreasonable for us to expect that. Anything else you guys can think of that pops into your head?
I mean, just one more thing related to what you said, Greg, is that we want people to be proactive and kind of like, it's obviously the PT school curriculum alone is not sufficient, but we've also had people that have reached out or even like students where the questions they're asking us is stuff that like even we don't really care about sometimes. And so, yes, like if you want to do things that are like performance oriented, that we do in our environment that aren't like purely PT centric and you don't get in your curriculum, that's fine. But it's like, if you're not comfortable like working with, a post-op knee surgery patient, 2 weeks out, and you don't know how to like mobilize a knee or assess a joint, it doesn't matter like how esoteric you can get with other stuff. So, I'm not saying the PT school curriculum is sufficient, but you need to know it and be very comfortable with it, because that's the basics. I think there are some people who it's like, you're still a PT before you're all these other things, and you need to be comfortable doing those basic things, because otherwise like you're not like actually a PT or something else.
Yeah, I would add like under the intangibles kind of list from what you're talking about there, Doug, is like honest and humble, because I think those are two things that you want somebody who is truly honest about like what they know and what they don't know, because there's no other way to actually develop your skills unless you can truly be like self-reflective and be honest about like what it is you do and do not know. Like I think we've talked to like our students that we've had here in Jersey in the past, and it's funny because sometimes they like want to try to impress us with things that they know, but they don't really know it. And it's like, dude, I don't care. Like that doesn't impress me. What impresses me is you being good with clients and being honest with them and helping them. It's like, because you read some blog post or you watch some video that sounds cool, but you don't know how to apply it. It's like that's just that kind of a waste of time. And when trying to learn things that, like you said, don't apply to like the people that you actually work with, it's like, that's cool, that's all stuff that's really interesting, but ultimately like we love reading more theoretical and not necessarily always the most practical information, but ultimately it's like we have to be doing stuff that's going to improve the care that we give to the people that we are actually working with. And so if you're only reading about like high performance athletes and how to train elite athletes, but you only work with like kids, it doesn't make any sense. Or if you only work with a geriatric population, it doesn't really make any sense. It's understanding and being honest about what you know and what you don't know, and being humble about that, because it is, I think we all have our own egos and want to like be smart and look smart, but ultimately it's like you have to be humble about like, no, this is like what I actually do, and that's awesome. And when people can be truly honest about what it is they do on a daily basis and what they do and do not know, it's the only way we can actually develop more knowledge and more, and actually try to become an expert.
Yeah, and that reminds me of you saying that reminds me of a time when I was with Alan Groover for our clinical, that we all did. And I remember him just saying that he wants to work with people that want to work with him. And that was like a really cool thing to hear him say, because he's essentially what he's saying. And he would go on and say, like, I'd rather work with, Joe Schmo, 45-year-old dad who just had a rotator cuff repair because he wants to be with me, as opposed to like, I'm going to go chase around some professional athlete because I want to look cool and sound smart and look like I know, more than the next guy. Like, I just want to help people, and I don't really care who they are. And that was very, very apparent as a student with him, because we were working with people, in his clinic. There might be, a young, 13-year-old kid who has like some sort of like neurological disorder or something like pretty involved with, which as a student, you're like, oh my goodness, like, what am I even supposed to do here? And then at the same time, like, across the room is like a professional baseball player from a Major League Baseball team. So it's like, there was such a disparity, or not disparity, it's such a big range of who he was working with and who his clinic, his employees were working with. But I think that's a really important thing to think about too. Like, the question is always like, oh, well, how do I work with professional athletes? What do I need to do to become, work with a professional athlete? And though that might be like a goal of yours to work in professional sports, that's totally fine. That's a very, reasonable goal to have. Like, if that's the setting that you want to get to and you want to work there, like, you still have to work well with everyone up to that level. Like, you can't just jump and work with professional athletes right out of the gate. Like, you first need to be able to work well with anybody before you can work well with any one specific population. So I guess that kind of goes back to just being a generalist over being a specialist, and being able to work with anybody and applying the same information. Like, we're all doing the same things, just with different sorts of techniques at different times. Just whatever's appropriate for that person is always what we go back to. Yeah, and it's just like, don't walk before you can crawl, kind of going back to what Trevor was saying. Like, don't ask us about some crazy like jaw mechanics thing and like tongue movement in the mouth when like you can't coach a push-up. Like, I could care less about you bringing up some sort of blog post about the tongue when, like, you're having a hard time working with a 16-year-old kid after an ACL surgery. So those are definitely huge bullets for us. Anything else you guys want to throw in there for the last couple minutes?
No, I think that's good.
Well done.
Awesome. Yeah, well, let's wrap this one up, and then we'll do another one soon. So thanks for listening, and we'll see you next time.
Thanks, everybody.
Thank you for listening to the Resilient Performance Podcast. As a thank you for listening, please use promo code PODCAST for 10% off our professional development resources at resilientperformance.com. Also, make sure to sign up for our mailing list to receive exclusive content and promotions.